which predisposes people to have neurocutaneous syndromes if there is a genetic abnormality which affects that particular layer of the developing embryo. So I'll give you some of the major neuroendocrine ectodermal syndromes that we encounter are neurofibromatosis, both neurofibromatosis type 1 and 2, which are two very distinct syndromes. Tuberous sclerosis is another major syndrome that is encountered in pediatric neurosurgery, and you will often see adults with that also. Then Sturge-Weber syndrome. You may have seen people with a port wine stain on the forehead or the face, and they may have a syndrome called the Sturge-Weber syndrome. Von Hippel-Lindau disease, commonly called as VHL, in which you have tumors which affect not only the brain but the retina. They can also sometimes affect the kidneys. And hereditary hemorrhagic telangiectasia, unknown, relatively newly, where they found a genetic disorder. So there's a lot of interest in the medical world now on HHT. Basal-Neves syndrome, neurocutaneous melanocytosis, which is the cause of refractory or very difficult to control seizures in children. And then there are some other minor syndromes, not very common, rarely seen, but very much of importance. So majority of these syndromes, all of them affect the ectoderm, and visceral involvement, whenever it happens, is directly extension of the neural involvement. So the visceral involvement is secondary to the nerves getting involved. And all of them have a genetic predisposition, and nearly all of them have some type of skin manifestation. And because it is there is an underlying genetic abnormality, these patients should not be treated with ionizing radiation, and they're very sensitive to that, in that the tumor, once it develops, it already has a genetic abnormality, and then if you, on top of it, if they have ionizing radiation, the risk of malignant transformation in those sort of tumors is high. Therefore, in patients with neurofibromatosis type 1 or even in type 2, we don't like to give radiation if possible. So on that note, there are some other syndromes, some of which are listed here, in which you can get neurological malignancies, especially, for example, with Li-Fraumeni syndrome. You can get medulloblastomas, and in those patients, radiation therapy is not a good idea. So I'll discuss three syndromes here. One would be tuberous sclerosis, which I'm sure you're going to see in pediatrics and even when you go on the adult service. So tuberous sclerosis was initially discovered or described by Bonneville in the 19th century, and it is characterized by three major things. One is seizures, which can be anywhere from local seizures or generalized seizures, but what is interesting is that they often become very difficult to control soon. And many of these patients would come to surgical treatment at some stage, many of them in their younger age groups. And then they have facial rashes, which looks like acne, but is not acne. And I'll show you a picture of that. It's called adenomatous sevation. And then they often have developmental retardation or developmental delay of varying degrees. So it's an autosomal dominant syndrome which has variable penetrance and expression, and as you see here, it is not infrequent, and we have a fairly large caseload in our community. And now, not all of these are passed down from parents to children. About 2/3 are new mutations. So you will have normal parents having patients with children with tuberous sclerosis. So it's as I said, it's an autosomal dominant disorder. It's a variable penetrance, which means that the clinical presentation can be very wide. And the two genes which are involved in this, which is called TSC1 and 2, they're on two separate chromosomes, and they both produce proteins which are tumor suppressive to them, and they mediate their effects through the mTOR pathway. And therefore, what is interesting is that now with drugs coming up which are mTOR inhibitors, especially rapamycin and everolimus, the management of these patients has become, easier, and there's more to it than just giving anticonvulsants or offering surgery when they develop tumors. So what are the major clinical features that they have? This is what is, they have a facial angiofibromas. It's called adenoma sebaceum. So as you can see, it almost looks like rosacea or acne, but it is not really that. Then they can develop hypomelanotic macules, and this is one of those. It can be anywhere in the torso, on the extremities. And what is interesting is that, in somebody